Hi, this is Dr. Hubbard. I publish the website thesurvivaldoctor.com. Today I'm going to be talking about what we call a nursemaid's elbow or a radial subluxation. It happens in usually smaller children. I don't have a smaller child, so this is my older child. It'll be my one to demonstrate on today. And I'm going to raise up her sleeve here and give you an idea about what we're looking at. Nursemaid's elbow, or radial subluxation, is the same thing. It's usually called nursemaid's elbow, but it's a stereotypical type thing where that maybe you have a young child and supposedly a nursemaid. The nursemaid jerks up the child like this. Or she's walking along at the mall and all of a sudden jerks up like that. Or the child does that and starts swinging, and it puts a lot of stress on the elbow. Another way sometimes happens is you're in a really big hurry and you're putting the clothes on, you jerk it through the sleeve there. Another thing is a father or mother could be swinging the child like this. Any of those things is going to mess up, or can mess up, this area right here, which is the radial head of the elbow. If you try to rotate the hand at all, or the arm, they're going to really start crying. If they keep it still, usually they may be crying, but it's mostly anxiety. They're not in a lot of pain. Only when they move it do they get in a lot of pain. The thing that is injured in this is one of the two bones of the forearm. It's the radius, and it's right where the radius, or the radial head, joins the upper arm. Okay, and you can see that on the skeleton here. Here's the radius, here's the upper arm. It's the thumb side. Goes up through here like this. Now the treatment is to have the child try to relax as much as possible, or get their mind off of this. Try to roll their hand up like this, where their palm is up, and bring the elbow up. If you have your thumb on the area of the radial head, you'll feel a pop. A lot of times you will. But the other thing is that they'll start moving their elbow, and they'll start moving around. If they're moving the elbow, you got it in place. If not, you can try it one more time. If you don't do it the second time, then you need to stop. You need to see a doctor. There's usually not going to be any swelling there. Usually that's going to be the treatment. They're moving their elbow fine. They're playing again. As long as you don't re-swing them, then they should be fine. You don't have to put a sling on it. That should be the end of it. If you are not able to do it, then you could assume that there could be a fracture there. We'd put ice packs on it, because fractures of the elbow can get bad if they start swelling. They can start cutting off the circulation here, and you need to get to a doctor as soon as possible. And that's the end of this video, and you can find it on thesurvivaldoctor.com, my website. Thank you.